So a question from Cliff about the debt. How do you expect your children and grandchildren to pay for the $16 trillion debt, and how will they restructure the $100 trillion Medicare and Social Security obligation?
Question. So let's talk about Medicare and Social Security here, because Social Security is not related to the debt and deficit of the United States, right? Social Security is outside, has its own major issues. In 20 years, it essentially starts bringing in less money than it sends out, but it is not responsible for the debt. Medicare is partially, there's part of Medicare that funds itself through payroll taxes, but the general fund also pays for part of your services under Medicare. But both of those programs are in absolute crisis, and they will start sucking money out of the Treasury if you don't fix them. Medicare flips, essentially, starts taking in less than it sends out in 10 years. Social Security in 20 years. Social Security is relatively easy to fix because there's only a couple ways that you can fix it. You either put more money in or you send less money out. I would argue to fix it in this way. There's a cap on the amount of your income that's taxable for Social Security. Right now it's about $100,000. That used to allow us to collect income taxes for Social Security purposes on about 90% of income in this country. Now, because so many people are making more than $100,000 and so many people are making more than $1 million, we're only collecting Social Security taxes on about 82 or 83% of income in this country. Some people say, well, we should just eliminate that cap and all of your income should be taxable for Social Security purposes. I don't think we should do that. I don't think we should go that far. I think if we just went back to if we just raised the cap back to the point at which we were collecting 90% of income for Social Security purposes, we would largely, if not completely, solve the underfunding of Social Security without having to cut benefits. Why I'm nervous about cutting benefits is, one, because in this economy, there's just not money under the mattress for seniors. If they all of a sudden get another series of 0% increases in their COLA, there's not anywhere to go for these seniors when rent is increasing and fuel prices are increasing and groceries are increasing. And I also worry about raising the retirement age because, again, in an economy that's already struggling to find enough jobs for people of non-retirement age, if you all of a sudden move it from 65 to 70, or 67 to 70, you are going to force millions more people back into the job pool. And frankly, I've always thought that raising the retirement age was a really convenient thing for somebody that spent their life working at a desk to advocate for. It is something very different to ask the nearly 20% of our workforce that works every day with their hands, and with their backs, and with their legs, to do those jobs underneath your sink or in the factory floor when you're 69 or 70 years old. So, quickly on Medicare, here's the deal on Medicare. There is so much efficiency to suck out of the Medicare system. The differential right now between how much we spend per patient in Connecticut and how much they spend in Texas or Louisiana, the difference between efficient delivery systems and inefficient delivery systems, essentially solves the problem for you. If you took the most efficient healthcare delivery systems in this country and took their practices and required those practices to be the practices across the country, you would largely solve the underfunding problem within Medicare. We just have a system right now that essentially rewards the amount of medicine that's practiced, because we have what's called a fee-for-service system in which we pay per procedure, rather than a system that rewards quality, whereby we say to a physician or a hospital, we're going to pay you more if you actually keep your patients out of the hospital. If you keep your patients healthier, we'll pay you more money. Today, we say exactly the opposite. We largely say we will pay you more money if your patients are sicker. If they're in your office more, if they're in the hospital more, we'll pay you more. We just need to flip that presumption. If you do that, if you essentially have money track health rather than money track volume of procedures, you can largely fix the problem in Medicare. Now, if that doesn't get you all the way there, then I would agree that we should probably have some increased expectation of people that are making higher incomes, that they should probably have a little bit higher portion of their income that goes to help pay for those procedures than lower income people, that we should sort of means test essentially Medicare. But I don't know that you even have to get there if you invest in those important reforms on the way that we pay for healthcare.
What about the